So, hey there, it's Dr. Hurst, and we are going to talk today about the deadliest disease. So, the most common health problem in America is one that affects more than 92% of adults. And this health problem is not only the most common, it also is the most common root cause of high blood pressure, unhealthy cholesterol, and unhealthy weight, which are the underlying drivers and the most common root causes of the diseases that kill us, like heart disease, cancer, stroke, and dementia. So, this health problem is called insulin resistance, but you may know it by other names like diabetes, prediabetes, glucose intolerance, and metabolic syndrome, which are all different names for the same underlying problem of glucose and insulin metabolism. So let's start with the basics. What is insulin? So insulin is a hormone that gets energy like blood sugar into our muscle and cells, and it is also the primary driver of fat storage. So what is insulin resistance? Well, insulin resistance is when our cells become less responsive to insulin. So what happens is the cells stop responding to insulin and the pancreas responds by generating more insulin. So our overall blood insulin levels go up. So here's how it works. Insulin resistance leads to higher insulin levels. The high insulin levels lead to inflammation, but also unhealthy fat, high blood pressure, unhealthy cholesterol, and high blood sugar levels. This leads to metabolic syndrome, which causes heart disease, cancer, stroke, and dementia. And of course, these diseases lead to shortened lives burdened by chronic illness. In other words, a decrease in your health span. So, one of the analogies that I think is helpful in understanding insulin resistance is imagining your cells like little islands that need bridges to get fuel across to the factories, which are the mitochondria being the energy producing aspects of our cells. So our factories need a constant supply of fuel, and insulin are the trucks that bring that fuel over the bridge and into the factories. So, and when everything is working well, the fuel, which is the glucose, arrives, the trucks, meaning the insulin, arrive in perfect timing to transport the fuel across the bridge, meaning the cell membrane, to meet the energy needs of the factories. Now, what happens when there is insulin resistance, however, is there is some kind of blockage or traffic congestion that leads to an accumulation of trucks, insulin, and eventually fuel, glucose, on the bridge. So this blockage is called insulin resistance and can be caused by several factors. Number one, there can just be too much fuel coming in. So excess glucose, too much fuel will lead to too many trucks, insulin, and traffic will back up. Number two, there could be construction on the bridge. Factors like lack of sleep or excess stress, hormonal changes, or exposure to toxins can slow down or obstruct the truck's movement across the bridge, meaning insulin resistance. Or the factories could just shut down. They're not taking in more fuel. Fuel starts to back up. The trucks start to back up. This is when we do too little exercise. The factories shut down, and that leads to a backup of traffic and fuel. So the backup of the trucks, meaning the insulin, leads to pollution, and that's inflammation, fat accumulation, high blood pressure, unhealthy cholesterol. And eventually, there's too much fuel for the available trucks. This leads to higher blood sugar levels, which we see as prediabetes and diabetes. So there are three levels of insulin resistance. There's insulin resistance, prediabetes, and diabetes. So insulin resistance is when your blood sugars are still normal, but you just need too much insulin to keep those blood sugars down. The next stage, as things progress, the blood sugars go up mildly, still with too much insulin. This is prediabetes. And then when the sugars continue to go up and become severely elevated, this is diabetes. At first, with type 2 diabetes, the most common type of diabetes, the insulin levels are too high. Eventually, the pancreas can burn out, not be able to produce the insulin, and there could be too little insulin in the late stages. So how do you know if you have insulin resistance? Well, if you have any of these signs, you likely have insulin resistance. You have too much fat, either overall body fat or you're carrying too much fat around your belly, often represented by the representation of visceral fat. If you have type 2 diabetes or prediabetes, you do have insulin resistance. If you have a low HDL cholesterol and high triglycerides, that would be a sign of insulin resistance. If you have high blood pressure, and for the women, if you have polycystic ovarian syndrome or a history of gestational diabetes, then you likely have insulin resistance. What are the causes of insulin resistance? Well, there are 8 common causes of insulin resistance. The first and most common one is eating too many calories. Too much fuel, eating and drinking too much calories can lead to insulin resistance and is the most common contributor to insulin resistance. Or maybe the wrong calories, highly processed foods, foods high in added sugars or refined grains like white flour, spike insulin and lead to too many calories, of the double whammy. Or too little activity. Your factories, the mitochondria have shut down because they're not being used. When less energy production is necessary, insulin resistance can be the result of that. Too little sleep. Sleep deprivation leads to hormonal changes that make our cells more insulin resistant. This is like the construction on the bridge, as is too much stress. And lastly, toxins, smoking, and excess alcohol can also increase insulin resistance, like construction on the bridge. Now, some people have a genetic predisposition to insulin resistance, although I would say this does not mean there's nothing you can do about it. Your genes do not have to be your fate. Instead, I think that means there's even more benefit to doing the things to treat insulin resistance if you have a family predisposition to insulin resistance. And then lastly, the vicious cycle where insulin resistance leads to fat accumulation. Again, most commonly visceral fat. The increase in visceral fat leads to more insulin resistance and sets up that negative feedback loop. Okay, so how do we stop that feedback loop? How do we reverse insulin resistance? Well, first of all, just emphasizing that it is achievable to reverse insulin resistance. So there are 2 essential goals to improving insulin resistance. Number 1, we need to lower your insulin levels, reduce the amount of insulin in your blood. And then number 2, we need to increase your cells' insulin sensitivity to get your cells to start responding to insulin again. So let's look at number 1, lowering your insulin levels. There's 3 ways to do that. Lower the surges in fuel. This is avoiding those highly processed carbs and red foods. Number 2, lower the total amount of fuel, lower the amount of calories that you're eating. And then number 3, for some people, increasing the time when the insulin levels, the fuel levels are low. For some people, time-restricted eating, meaning narrowing the eating window, or even intermittent fasting when you go more than 24 hours without significant calorie intake can all be effective tools at lowering insulin levels. Now, let's go to the second part, though, because this part is important as well. Although decreasing fuel intake is important, we also need to eliminate that traffic congestion, that construction on the bridge to fix insulin resistance. And there are 6 areas of opportunity to increase your insulin sensitivity. The first and most powerful one is physical activity. Regular exercise is important. It's like opening up those factories to facilitate the fuel intake and fuel utilization. Zone 2 training, you can talk to your remote care coordinator about this, is a safe and effective strategy to improve muscle metabolic efficiency and insulin sensitivity. But when combined with strength training and building muscle mass, then those effects are not just additive, but synergistic. And that really is the fountain of youth, adding muscle mass and becoming insulin sensitive. Restorative sleep. Chronic sleep deprivation leads to those hormonal changes, as we've talked about, that increase insulin resistance. But also chronic sleep deprivation leads to impairment of appetite regulation, so that people eat more and feel less full. Similarly with stress, chronic stress will set your body up to be insulin resistant and make it impossible to do the things like lose weight or get your blood pressure down or improve your cholesterol numbers if you are chronically stressed and not handling that well. Avoiding toxins, tobacco, excess alcohol are most common, although there are others, can be an effective tool for improving insulin resistance. And then staying connected socially and to your purpose, also very powerful driver of health and insulin sensitivity. And lastly, medications. Several medications may jumpstart a comprehensive approach to insulin resistance. Now, I'll emphasize these medicines are not cure-alls. They're not fixes in themselves, but as part of a comprehensive approach, they can be helpful in improving insulin sensitivity. So I'll end this with this advice. We are here to help. If you want the best chance to avoid heart disease, cancer, dementia, stroke, so you can live a long and vital life, then you have to be insulin sensitive. Our team here are experts at reversing insulin resistance. Let us know how we can help. We are excited to be with you on this journey.